Armajun is an Aboriginal community-controlled health service, and we commenced in 2006. It is the only healthcare service in the service area that is governed by Aboriginal people for Aboriginal people. We're based in the New England region of New South Wales. Our main office is in Inverell, and we have outreach offices in Tenterfield, Glen Innes, Tingha and Armidale. We have a voluntary board that is elected by its membership, and 100% of our membership are Aboriginal people. And we hold regular community consultations to receive feedback on our services and to establish what needs and gaps there are in service delivery, and that is a very important part of our service. I just broke up this presentation with some pictures because it's very wordy. And that's a NAIDOC celebrations, and also what our exercise physiologist makes us do. Similar to other Aboriginal community-controlled health services, our definition of a health service is health to Aboriginal peoples is not merely a matter of the provision of doctors, hospitals, medicine, or the absence of disease and incapacity. Health does not just mean the physical well-being of the individual, but refers to the social, emotional, cultural and spiritual well-being of the community. From a holistic health point of view, it is the provision of wraparound services, specialist, allied and other supports that assist in meeting the needs of our community. Armajun is a bulk billing medical service. We do receive Australian government funding for primary health care and drug and alcohol services. We receive New South Wales government funding for oral health services. We don't receive a lot of money from RDN, but I think it's the best value for money. And we receive funding through RDN for specialist and allied health services, and in the past some GP outreach services. We are accredited with the RACGP and the Australian Dental Association, and we're also accredited as a training provider for GP registrars. We cover about 49,000 square kilometres, from Walker in the south to Tenterfield in the north, west to Binga and Warrialda, and east to the edge of the Tablelands. About 7.4% of that population of that area are people of Aboriginal descent. 93% of all Armajun clients are people of Aboriginal or Torres Strait Islander descent. In the last financial year, we saw about 7,250 individual clients. In 2010, we had 5 staff. In 2019, we have 75 staff. And we've grown from having less than $1 million in total income to over $10 million. And I believe that our growth and range of services that we now provide can be largely attributed to the support we've received from the New South Wales Rural Doctors Network. Armajun was a late starter in the AMS world. We didn't receive funding like a lot of the older, more established AMSs did, and there's no way we could have provided the comprehensive primary healthcare services that we do without the support of the Rural Doctors Network. For me, our relationship with the Rural Doctors Network started on the 23rd of March 2010, when we received funding to provide a GP outreach service to Tingha. Tingha's a small village, for the want of a better word. It's 25 k's from Inverell, about 25% Aboriginal population, and we received funding for 1 day a week GP outreach services supported by a nurse and a health worker. That's a bit of our team. I told you I was breaking up with photos. It's a great team. And in 2014, we received funding for GP outreach services in Glen Innes. And then in 2016, we received RDN funding for GP outreach services in Armidale. Finally, in 2017, the federal government saw the light, and they gave us enough funding to actually consolidate and grow our outreach services in Tenterfield, Glen Innes, Armidale and Tingha. But that initial funding, that funding support we received through RDN, they allowed us to enter those new service areas, build community trust, have sustainable and viable services, and demonstrate that we had evidence of need to attract that further funding. Without RDN support, Armajun would never have been able to establish our services in Tingha, Glen Innes or Armidale, and even Tenterfield, because we just couldn't do it. One service that RDN do fund us for is early childhood screening. Now, it may not seem very important, but I think it is absolutely pivotal to giving kids a chance for a viable future. So our audiometrist and Aboriginal health worker, which, mind you, RDN helped train, last year went to 78 schools and early childhood centres, screened over 900 kids and made 212 referrals to GPs, audiology, speech therapy and ENT specialist services. We do provide a lot of other services, or we do receive a lot of, run a lot of other services that are funded by RDN. There's a whole list of them. ENT services. While we have clinics in Inverell and soon to be Armidale, one of the big things that we wanted was actual surgery in our region because otherwise they have to travel to Newcastle. We've been asking for a surgery time in Tamworth Base Hospital since 2014. Finally, in 2019, it became a reality. And I need to commend RDN because they stuck by. They stuck by us for those 5 years of battling with the bureaucracy to get surgery time for an essential service. Audiometry, dietitians, GP obstetricians, speech therapy, not funded directly to us, but provided on-site, optometry, exercise physiologist, paediatrician, podiatry, also not funded. We don't receive the RDN funding, but another organisation does health-wise. Out of our clinics, psychiatrists, psychologists. Not only do they provide all those allied health and specialist professionals, but they provide you with the support staff that can actually make those clinics a lot more productive and effective. So we also have funding for nurses and Aboriginal health workers. Outcomes. For the last couple of years, Armajun has joined with our local community health and Department of Education to hold a one-day screening at our local library. Reporting on the outcomes of that day, Bev Walls, who's a support teacher at the local school, made the following comments. You know, as with last year, because it's been running for a couple of years, an interesting aberration is that the Aboriginal childhood population of Inverell fares much better than the nationwide average. Aboriginal children are 10 times more likely to suffer from OM than non-Aboriginal children and are 70% more likely to have recurring otitis media. Armajun, Aboriginal Health Service, has been very active working in schools and preschools in the Inverell area. And I must say we do it across the entire service area. In providing ear health checks and then referring to other agencies as needed. This may be a reason why the results for Aboriginal children at Inverell were not substantially higher than non-Aboriginal children. This is a great outcome for preventative health and for those kids' futures. I asked our doctors to give me some feedback on RDN services to bring to this presentation. Typical doctors, they gave me an essay, not a brief comment, but you can read them at your leisure. This Armajun GP highlights that RDN makes services more accessible for our community. And services are easier for our doctors and our staff to organise and easier for clients to actually come into those services. They don't have to travel long distances and we can support them with local transport and Aboriginal health worker support. This results in better health outcomes. This is our Armajun mascot, Kev the koala. Another GP highlights the issue of compliance rates often experienced in AMSs. During my time working in Aboriginal medicine, patient compliance strikes me as the biggest factor to influence health outcomes in our Aboriginal population. RDN funding allows Armajun to provide essential specialist and allied health services at the Armajun room in Inverell, increasing the chance of attendance by our clients for these appointments. Improving attendance rates enables Armajun GPs to continue to improve client care and therefore health outcomes for the Aboriginal community in our region. Kalina reminded me one of the best supports that RDN actually give us, and that is about upskilling our staff. They have provided us with a lot of support to train our staff and upskill our staff. We can also help clients who don't qualify for NDIS, and we all know those people. We can offer them a range of allied and specialist support services. It allows for early intervention. It prevents us having, people getting to an end stage of a disease, which is a common occurrence with the Aboriginal community, and leaving it too late for effective treatments. It has a really positive and holistic effect on the whole family. If you have one ill family member, it impacts on the whole family. It allows us to provide continuity of care. Our specialists and allied health professionals work hand in hand with Armajun. One of the reasons I believe why they do work hand in hand is that we have the capacity to choose the service provider that we want and who we know will work well with our community. Some of our staff, Armajun paediatricians, we've had 2 paediatricians funded through RDN and both have been absolutely excellent. And our current one, he's especially understanding the issues we face in rural communities, being able to access service and diagnostics to assist the children. He liaises with the school and all the other services that we're involved with. He regularly gives out his personal phone number for parents and carers to call him at any time with any issues. I asked the staff to give me some success stories so I could come and talk about them, and they told me there was no real standout good news stories, as he provides such a high standard of care with all children. They're all success stories. But one that did strike me was an 8-year-old girl who's in out-of-home care, who's had 22 placements. Can you imagine how traumatised that child is? Our current paediatrician is working very closely with the family, the friend and the out-of-home care service to try and stabilise that placement so that child does have a future. And that's the value of RDN services. That's our farewell to our first paediatrician, Keith Howard. He got right into it. He's the guy in the hat. Another really valuable RDN service is our ENT services. And the staff comments, all visiting specialists have shown an enormous amount of understanding and respect towards our patients and the difficulties they face with comprehension or health literacy, financial, logistics, etc. They have all gone out of their way to accommodate our patients in every way without judgment. One story is, a female client was referred initially to our ENT for a long-stand hearing loss. They were diagnosed and then referred for surgery. On the day of the surgery, because it was down in the Newcastle area and there's lots of hospitals there, she got lost and she got mixed up and she didn't know which hospital to go. Anyway, she finally got there 2 hours later. That specialist who had actually visited Armajun, he waited for 2 hours and he performed her surgery. Isn't that terrific? But that's about they're having that choice of provider and having people who relate to our community. A fact in a factor in the enormous success of our clinics are our referral pathways, are the involvement of a lot of other services. And a lot of those are funded through RDN. Like with our ENT, we have the hearing screening for the kids, we have the audiologist, we have speech therapy. And there are other programs like the integrated team care and schools who are also very, very supportive. The future. I would like to see us maintain and grow our allied and specialist visiting services through RDN. I would really like to maintain our early childhood and school screening programs. I just think they're so, so essential. I did present at the 30-year celebration, and one thing, if you get to know me, I'm consistent and I'm persistent. I want GP services and a GP obstetrician from Tenterfield. Tenterfield is on the Queensland border. Armajun doesn't currently provide GP services there, but we want to. But most importantly, if you live in Tenterfield, you can't have a baby in Tenterfield. You have to go elsewhere. Hunter New England send everyone south. Tenterfield people don't relate south. They relate across the border into Queensland, Stanthorpe, Toowoomba, Brisbane. The GP obstetricians out of Stanthorpe Base Hospital, they deliver most of the Tenterfield babies. They are willing to jump the border. But if anyone out there is from a border area and knows how to deal with the cross-border issues, please come and talk to me. But I've got it. I think I've got it on the priority list for RDN funding. It would be great. You know, government departments, they talk about giving Aboriginal services control over the services they provide to Aboriginal people. But in my opinion, mostly, it's just talk. They give us the funding and then they tell us what to do with it and how to do it. RDN don't just talk, they actually do give us control. They listen and they fund the services as determined by our communities. And then we have the ability to choose the provider who's best suited to our needs and who's best suited to deliver the services in our communities. And if I have a message for the government people here, it is look at the model of the service delivery provided by the Real Doctors Network and fund it more and make other programs funding similar. Thank you.